Okay, first I'm going to gather my supplies, and I have my clean trach kit here, and it's not expired, no rips or tears, it's in good conditioning. Make sure I grab my gloves, and then I'm going to grab my sterile normal saline, and this has not been opened yet, it's not tampered with, and it's not expired. So I'm going to set that there, and then I'm going to set this over here for now. And knock, knock, knock. Hi, my name's Tiffany. I'm going to be your nurse today to do your trach cares. Close the privacy curtain. Wash my hands. So can you please tell me your first and last name and date of birth? Okay, thank you. And the bed is locked, and it is at a working level for me. And so like I said, we're going to be doing your trach cares today, and I would make sure that I listen to the lung sounds to assess if the patient needs any suctioning, but we don't need to do that right now because we're going to be doing that here shortly after this. And I'm going to assess the patient, make sure, check for any cyanosis, see if their O2 sats are dropping, difficulty breathing, sounding gunky, anything like that. Okay, wash my hands again. I'm going to put my gloves on. And I'm going to remove my oxygen. And then I'm going to remove my old dressing here, but I want to make sure I stabilize the trach so it doesn't become dislodged. And then I would be looking at the secretions, the color, the amount, any odor. Make sure I'm checking around the stoma site there for any redness, inflammation, swelling, checking the integrity of the skin and the amount of secretions there and the consistency. And then I'm going to want to put your oxygen back on, and then I can throw this away, remove my gloves, toss that in the garbage, and then I'm going to wash my hands. Okay, so I'll grab my trach kit here and my normal saline, and then if I wanted to, I could have grabbed the peroxide as well and then done a 50-50 solution, but we do not have peroxide here, so we'll just be doing the normal saline. And I'll want to make sure that I first open my normal saline, make sure cap side is up, and then I'm going to open my trach kit away from me. And I don't want to remove that all the way in case something goes wrong and I have to start over for this video. Okay, so set this aside. And then I need to put on my sterile gloves. Making sure not to contaminate my sterile field, my sterile tray, I should say. And step back so I'm not on top of my sterile area. My gloves are all sticky because they're sweaty from practicing. Okay, grab my other glove. Okay, I could take this, throw that in the garbage, and then I need to grab my sterile drape. open this up. Make sure I put the shiny side down, which it's kind of hard to see right now. Okay, and then I'm going to disperse all my items, my sterile items onto my sterile field. My ties. Okay, and so then this is going to be my sterile hand. This is going to be my clean hand. And so I want to pour my saline into my tray. And I would make sure that I'm covering up the label and pouring. I hopefully wouldn't have to use a bottle like this, that's for sure. And then, like I said, if I had it, I could pour peroxide into that one there for my 50-50 solution. Again, this is my clean hand. So next I will want to remove my oxygen, set that aside, and I'll want to hold that there, to twist at the hub there, so then I can pull it out, touching, making sure that that remains sterile on the inside there. And I want to pull kind of at a curve and out. And then I can place this in my solution. I'm going to put the oxygen back on. And then I am going to use my sterile hand to grab my pipe cleaner. Touching the hub. Okay, making sure to clean on the inside and on the outside. Okay, and then I'll want to rinse that off because the peroxide would have been harmful, or it can be damaging and hard on the skin, the tissue. So I'm going to let that rinse off there. Okay, and then next I am going to remove my oxygen. And then I'm going to make sure I maintain sterility. Only touching the hub here. So I can put that in, and then I'll want to lock it in place with the hub, and I would push it in at an angle with the curvature of the human anatomy. I'm going to give oxygen back, and the sterile portion of this is completed. And so next I'm going to want to clean the stoma, around the stoma. I'm going to use the last part of the tray here dip that in there. Make sure I keep my oxygen on my patients. I'm not depriving them of oxygen. And I'm just going to go around the stoma from the top to the bottom in a crescent moon shape, making sure I do not dislodge the trach. Okay, garbage. And then I'm going to do that on the other side as well. Garbage. I want to make sure that I dry that off on both sides, using a new Q-tip each time. Garbage. And then in my kit I also have extra gauze there that I could use to clean off the plate if needed. His plate looks okay. And I will need to put my dressing on the patient here. So I'm just going to move the oxygen out of my way here. And I'll want to make sure that I'm careful as to not to dislodge the trach. Push that under. Okay, and give oxygen back. Looks like he's doing okay. And I will need to replace my ties here. And I'll want to make sure I put the new one on first before taking the old one off to prevent any dislodgement of the trach. And this is much easier with two people. I've definitely realized that in real life too. Again, being careful not to dislodge trach. And then I would tie this in the back here. I'm going to remove the old ties. And that will be garbage. And then I want to make sure it fits snugly 2 fingers there, which it does. That's good. And I'm just going to assess how my patient handled the procedure, checking vital signs, O2 sats, appearance, cyanosis, and I'm going to clean up my mess, garbage, remove my gloves, wash my hands, and I'm going to make sure that the bed is in a low position. Do you need anything? No? Okay. And I'm going to make sure that I document how the procedure went, the size of the trach, and the characteristics of the secretions. And then I believe that's everything, because I already put your bed in a low position and gave you your call light. So if you need anything, please ring for me. Thank you.